Since practicing physical medicine for over 2 decades, there are common questions people have about lower back pain. Since I practice physical medicine, the focus of this report will be related to physical problems. Although lower back pain can have a host of other causes, including chemical, emotional, organic, and systemic causes, this report will focus primarily on what I've found in my practice. So here's a quick synopsis of what I found in 20 years of clinical practice. The lower back is made up of 5 movable spinal bones known as vertebrae. These vertebrae sit on top of the sacrum and the coccyx. Most people know this as the tailbone. Since the vertebrae are movable and are located on top of a movable platform, it is not unusual for the vertebrae to become misaligned. The difficulty with misaligned vertebrae is that they have a tendency to cause problems not only at the level of misalignment, but areas above and below misalignment as well. The body is amazing in that it will do everything possible to stabilize the area that is not functioning properly, and this can be a benefit as well as a problem. The advantage to the body compensating for a problem is that even with misaligned vertebrae, we are able to perform most of our daily activities. For example, if you have an issue in the lower back, the stabilizing spinal muscles will contract around the area that is causing the problem, thus allowing the areas above and below to move and compensate for the dysfunction. This allows us to perform most of our daily activities with only slight limitations or periods where we fatigue faster than normal. The disadvantage to having the muscles of the body compensate for the problem is that we often allow the problem to persist for periods of time, and it comes to the point when the body can no longer compensate and we experience pain and discomfort that destables us. This also becomes more of a problem as a clinician because it takes longer to fix the problem as well as longer to strengthen and stabilize the area once corrected. This is why physicians love the old adage, an ounce of prevention is worth a pound of cure. If you're experiencing lower back pain and have ruled out other causes, it's imperative to have your spinal structure evaluated for misalignments and to be corrected before it becomes permanent and non-correctable. One of the biggest examples of misalignment is a person with scoliosis. When the spinal vertebrae curve in abnormal ways, the entire body becomes affected, and functions that we take for granted, such as breathing and eating, can become almost impossible. This is why many orthopedists look to surgically correct the spine so that catastrophic illnesses are prevented. It is my goal to correct these issues far before ever reaching the point requiring surgical intervention. So my best recommendations to you are as follows. At some point in your adult life, you will suffer with lower back pain. If the pain persists for more than 3 days, it is necessary to have the problem evaluated by a trained professional. Many times, correction of these problems can be simple and are oftentimes quite effective. But if you let the pain continue, even if you are able to function, you are setting yourself up for problems in the future. To use a dental analogy, it's easier to fix a cavity than perform a root canal. So if you experience lower back pain, get checked today. Also, if you have further questions, feel free to visit our website.